Sure, thank you very much for having me. This past Wednesday, just a few days ago, the Cabinet of Ministers adopted 10 different decrees, which helps us to move the reforms of the healthcare system forward. The first and very important one is the new concept of public health. In Ukraine, there hasn't been any concept of public health taking care of the entire community, the entire nation, the health of the entire nation. Under public health are things like vaccines, biological agents that are used for biological security. There are also things like prevention of heart disease, of heart attacks, of strokes, type 2 diabetes, education so that patients don't get sick, healthy ways of living, exercise, the kinds of preventative medicine, whether it's infectious or non-infectious disease, that we in the West have been used to for many years. In Ukraine, there hasn't been a public health system at all in place. The only thing that was talked about was infectious diseases, and so there were some programs for vaccinations, but not much of anything else. So we presented the new concept on public health, which was adopted by the Cabinet of Ministers, and now we're able to put it into action. A second very important decree that was voted on and unanimously approved was the new concept on financing for healthcare. In Ukraine, up until now, there was a large amount of money called the medical subventia that was directly taken from the budget and handed out into the regions to the councils in the oblasts, in the district, or in the cities. They then decided what to do with that money, and most of the time they would give it to the hospitals and pay for infrastructure. So they would pay for the common charges, they would pay for gas, they would pay for electricity, they would pay the salaries of the employees, and by the time it got around to the actual patient, no money was left for the patient. So the new concept of healthcare financing is the idea that is in most Western countries that the financing follows the patient. So say in Canada, when a patient goes to see the doctor bills the national health insurance, or in Canada, provincial health insurance, which then pays for those services. And the Canadian pays his tax dollars. The tax dollars are used to make a pool of cash, of money, financing for the national health insurance, which then pays for those services. The same thing will happen in Ukraine. Starting in 2017, primary health care will be paid for by a national health insurer, where every citizen of Ukraine will choose his doctor, and that doctor will receive a certain amount of money to take care of that patient for that year. Starting in 2018, the healthcare insurance will start paying also for specialized care and for hospital care. They, during 2017, will come up with the tariffs or the cost of each of those different services, so that then the health insurer, national health insurer, will be able to pay for those tariffs for those specific services that are provided to the patient. In Ukraine, until this change, patients are not able to choose their own doctors. They are tied to where they are registered as their place of residence. So money is allocated to their place of residence, to that area in which they live, and whether they actually continue to live there or move somewhere else, that money doesn't follow them. It stays in that local area. Now each of those patients will be able to choose whichever doctor they'd like to go see, whether it's in the local area or somewhere else, and the financing will follow that patient to that doctor. Ukrainians don't have primary health care physicians. Very few of them do. Most of them go see specialists right away if they have some kind of a problem, and they don't have a relationship with a single doctor the way that most Canadians have. So this change in that the patient will be able to choose his doctor and start a relationship with that doctor so that they have someone to go to when they get sick, who can then pass them along to higher specialized health care or hospitalization when necessary, will really help to improve the health of the nation in general. There'll also be much more concentration on preventative medicine and prevention of disease rather than only treatment of disease, because until now, only about 1% of healthcare financing and the attention of healthcare has been on prevention. 99% is on treatment of disease. And we've learned over many years in international experience has been that putting in a small amount of money into prevention can really save a lot of financing when it comes to treatment, because preventative medicine is much less expensive than treatment is, and it also helps to save lives and to keep the population healthy. So those are the two big changes that have been that passed through in the Cabinet of Ministers this past week. There's also a new administrative system that will be starting in 2017. That's called hospital districts. As we know, Ukraine is divided into oblasts, and right now each of those oblasts is divided into raions, or districts. There are over 1,000 districts. Each one of them has their own administrative people, their own bureaucracy, and each one of them has multiple healthcare institutions that are supposed to take care of the people in that district. Very inefficient and very cost-heavy when it comes to the bureaucratic portion of what goes on, and with staffing, and again, not a lot of financing and not a lot of attention given to what's needed for each of the patients. So the change in the administrative, the way we're going to administratively divide up the oblasts, instead of having over 1,000 raions, there'll be about 100 hospital districts. And each one of those districts will contain the minimum amount of medical infrastructure that's necessary for the population of that district. Therefore, it'll be the minimum number of hospitals or intensive care hospitals, those hospitals that have all of the different specialties that work 24 hours a day and can give a very specialized level of care. And then a certain number of urgent care hospitals where patients can go and refer to if they become ill. Also a certain number of rehabilitation centers, palliative care centers, nursing homes, and also primary health care workers and primary health care centers. When we change the administrative division of the way the oblasts work, we will cut out a lot of bureaucracy. We'll also cut out a lot of the corruption that occurs along that bureaucratic level. And again, the financing will be given directly to those hospitals that have the most patients, the ones that are most active, because the money, the financing will follow the patient to where they go and where they get their care. Right now, there's going to be an optimization of those hospitals because there are too many of them. And we want to reprofile some of those institutions into other social services. Right now, there's a lot of inpatient hospitals in Ukraine, far more than is necessary for the population. Ukraine has the second highest level of hospital beds per population in Europe, second only to Belarus. So there's too many hospital beds. And we need to reprofile those hospitals into different types of social services, like nursing homes, like rehabilitation centers, those places that are really necessary for Ukrainians today, especially now that the war is going on in the east, and there's a large influx of internally displaced persons. It's been a burden on the infrastructure, the existing infrastructure, and secondly, because of the soldiers and the returning soldiers that have had injuries or have had other physical problems. And now that they're returning, we have a big need for rehabilitation centers and long-term care centers, which don't exist at this point in Ukraine. So we're hoping that with the passage of the procedure on how we will form these hospital districts, we'll be able to move forward. And in 2017, the regions themselves will decide where they want their hospital districts. Another thing that's decentralization. In Kyiv, we don't know the details in each of the different regions of what their necessities are. In Ivano-Frankivsk oblast, where there's a lot of mountains, they need to have a little bit more facilities because it's more difficult for patients to get from one facility to the other because of the weather conditions and because of the roads. Whereas in another place like in Kyiv City, we don't need as many institutions because we know that patients are able to get to those different institutions, and we have a lot of highly specialized institutions here. So each one of the different areas, each one of the different oblasts and cities have their own needs. And instead of deciding everything from Kyiv, we're now allowing the regions to make the decisions on their own. So in the end, what we're doing at the Ministry of Health is we're giving them the rules of the game. We're telling them that these are the minimum requirements for each of the hospital districts. This is the way that we'll be financing healthcare from now on. This is the way that we'll be concentrating more on prevention of disease rather than only treatment of disease from now forward. Now in the regions, they need to figure out how best to implement this for themselves. We've been traveling, myself and the deputy ministers have been traveling every week to at least one region and talking to them about the changes that will be happening in 2017 and 2018, what the plans are, what they should already be doing to plan ahead so that they know what will be happening over the next few months. And we've been getting some pretty good response. We're also getting very good feedback because, again, there's very unique situations in different places, and we're finding out a lot of information. Then when we travel to another region, we find out that they've already solved the problem that the region we had just been to is having. So we bring those regions together, and when they speak to each other, they're able to solve those problems. There's been a big problem with horizontal communication in Ukraine. Everything always goes up to the top and then from the top down, and there's very little horizontal communication. With decentralization, it's happened a lot more than it used to be. So we're trying to spread that into healthcare. For 25 years, Ukraine has not paid much attention to its healthcare. It has allowed that old Soviet system, the old Semashko system, which is paying for basically the infrastructure and not really paying for care of patients. The system existing for the sake of the system rather than the patient being at the center of attention. This system has been in place for 25 years, and only now are we unraveling all of these problems that have been happening over 25 years and changing the way the system will be providing care for each and every patient. It will take time. It's not something that can happen in a week or a month or even a year. We have a 3-year program. We're rolling it out the first year in 2017 for primary healthcare, in 2018 for the hospital and specialized healthcare, and then in 2019 with the highly specialized care, things like transplants, things like doing very complicated surgery. That will already be in 2019 when we bring all three of those together. 2017 will be a very busy year for us in the Ministry of Health because we'll be helping with changing the entire primary healthcare system and also preparing the specialized care in the hospitals for the changes that will happen in 2017. Those were 3 of the 10 different decrees that were passed. The other ones had more to do with the hospital Okhmadit, which you probably have heard of. It's a children's hospital in Kyiv. We passed some legislation which will help us to finance it so that we can actually open one of the buildings that has been being worked on for 5 years already and hasn't gotten very far. So we'll probably be able to, with this financing that we've insured for the rest of this year and for next year, we'll be able to open at least one of the buildings, one of the campuses at Okhmadit in the summer of 2017. There were 2 decrees that had to do with increasing financing to help pay for the salaries of healthcare workers in the regions before the end of the year, because there's been a problem with not enough financing for the healthcare workers for their salaries. So we released some money from the budget to help the regions pay for those salaries. So that's a really good thing. There's also another decree we passed, which is allowing the hospitals to have more independence when it comes to making decisions on financing. Again, because of the very heavily centralized process of healthcare financing, the decisions on what is to be done within a hospital is being made at either the level of the district council, the oblast council, or even in Kyiv. And so if a hospital needs to buy additional syringes and doesn't need as many bandages as they had estimated in their yearly budget, they have to go to the district council and present it to them, and it has to be voted on at a council meeting rather than the decision simply being made by the managers of the hospital. So we passed a decree where the managers in the hospital will be able to make internal decisions about financing to change the purchasing of equipment from one to another, or to change the amounts of purchase from one type of equipment to a different type of need without having to go into a higher bureaucratic level. That's something that, again, helps with decentralization and helps with financing. It's a much more effective way of using the taxpayer's dollar for every dollar of healthcare, instead of having to spend all this time having a decision made by people who really don't know what's going on inside the hospital, and it sometimes takes weeks to get something like this done. They'll be able to make quicker decisions right at the level of the hospital. That was another really important, untying the hands of the hospital workers, hospital administrators, so that they're able to provide more focused care for the patients that are in their hospitals or in their clinics. And then there were a couple other decrees that had to do with the financing of very specific areas of the changes that we're making. Those 10 different decrees are pushing forward the major concept of financial reform of the healthcare system and introducing a public health policy. Those are really the two most important parts of our reforms at this point. Just for a little background, to get to this level, to get to the point where we were having these decrees passed, we had to work for 3 months in having meetings starting from with the Prime Minister and his close circle, to a wider meeting of more of his advisors, to a wider meeting where we invited deputies from the parliamentary committee and representatives of large cities and regions to hear what these reforms are like, so that they get their input into a larger circle where we've been traveling to each of the regions and presenting it and having intake from each of those regions, to a larger circle where we went to each of the parliamentary fractions, each of the different political parties represented in Parliament, and we presented these reforms to them so that they understood what's going on. So over the last couple of months has been a large campaign of communication, so that the healthcare financing changes, the concept of public health is understood by those who will be voting for the laws that will be changing, and also those that will be implementing these changes at the local regions. So a lot of communication, very important for us, so that there is the input of those people who are most interested in what's changing. We need the legislative branch because there are some laws that need to be passed to change the system. We need the cabinet of ministers because it's the executive branch that will actually be putting this into effect. The medical community, including both the administrative and the doctors themselves, so that they understand what the changes will be, so that they'll be able to pass that along to the patients. And we're very actively engaged with patient organizations and listening to the patients themselves in what their needs are and where the problems have been. There's some very nice programs going on that have to do with eHealth, electronic health. What does that mean? Most people in the West would think that that's something that's doesn't even need to be explained. It's having electronic medical documents, having a registry of patients that each patient has their own unique identification number that follows them regardless of what kind of medical facility they go to, that their medical record can follow them in that way, that you can have electronic prescriptions. You can have electronic notes from the doctor when you're sick, so that you can show at work that you were at the doctor's office when you were sick. A lot of these electronic records don't exist in Ukraine. Everything is done on paper. So in the last couple of months, we've put together a consortium of IT specialists, of patient organizations, of business, and of doctors' organizations and representatives of the medical community, who are now doing an open platform eHealth program for Ukraine, such as the Prozoro system that was designed for purchasing. As we know, it's a very open and easily tracked system that shows how each of the tenders is put forward. So everybody can see very transparently online what's being bought, who's bidding for it, what prices are being bid, and who wins the bid. This Prozoro system was designed by a consortium of business, IT community, and those that were involved in economics. Now we're asking a similar type of product to be produced, but for medicine. We would like for medicine to have an entire software program, a system, where we can track patients. Each patient will be assigned a unique identification number. Each doctor will be assigned a unique identification number. Each one of the medical facilities have their own unique identification number. We can follow where the patient goes. We can follow what procedures they have through diagnostic-related group codes, DRG codes, which are used all over the world in medicine. Then we're able to follow each of those patients, what the disease processes are, so we can get real statistics and we can plan on public health. What kind of programs do we need? Are we having outbreaks of certain kinds of diseases? Are we actually helping patients that have heart disease to have less heart attacks? If not, what can we do to help them? And all of the statistical information that comes from electronic records will then be able to, will allow us to plan better on what our future needs will be and what kinds of doctors we need to train, what kind of specialties will be necessary, what sort of hospitals do we need, what medication should we buy, are the children being vaccinated or not? If not, what's the problem? And we'll be able to do a lot better planning than we've had up until now. Lots of things to talk about, as you can see.